The topic of this video lecture is drug antagonism. So what is drug antagonism? When one drug decreases or inhibits the action of another drug, they are said to be antagonistic. In antagonism, the combined effect of two drugs is less than the sum of the effects of the individual drugs. For example, the effects of drugs A plus B is less than the effect of drug A plus effect of drug B. Usually in an antagonistic pair, one drug is inactive as such but decreases the effect of the other drug. Depending on the mechanism involved, antagonism may be of the following types. 1. Physical antagonism. 2. Chemical antagonism. 3. Physiological or functional antagonism. 4. Pharmacokinetic antagonism. And 5. Pharmacodynamic or receptor-mediated antagonism. In this part of the video lecture, we will cover physical antagonism, chemical antagonism, physiological antagonism and pharmacokinetic antagonism. In the next part, we will discuss pharmacodynamic antagonism. So the first one, physical antagonism. Physical antagonism is based on the physical property of the drug. For example, charcoal absorbs alkaloids and can prevent their absorption, and therefore it is used in alkaloidal poisoning. The second type of antagonism is chemical antagonism. Here the drugs act as chemical antidotes. The two drugs react chemically to form an inactive product. For example, heparin is a negatively charged macromolecule and protamine is a highly positively charged protein. So protamine is used in heparin overdose or heparin poisoning. The second example, antacids such as aluminium hydroxide, magnesium hydroxide, sodium bicarbonate neutralize the gastric acid secreted by the parietal cells. In poisoning such as arsenic and lead, certain drugs such as bal, calcium editate, dimercaprol have a chelating action on the poison such as arsenic and lead. So they act as chelating agents and is very useful in the treatment of poisoning cases due to arsenic and lead and other heavy metals. Next is physiological antagonism. Here, the two drugs act on different receptors or by different mechanisms but have opposite effects on the same physiological function. That is, they have pharmacological effects in opposite direction. For example, the effect of histamine and adrenaline on bronchial muscles and blood pressure. Histamine acts on histaminic receptors and causes vasodilatation and fall in blood pressure. Norepinephrine causes vasoconstriction and increases the blood pressure by acting on adrenergic receptors. On one hand, histamine decreases the blood pressure and norepinephrine increases the blood pressure. So the blood pressure stabilizes, the effects are counterbalanced and the physiological system remains the same. That is, the physiological function is on blood pressure. The second example, effect of glucagon and insulin on blood sugar level. Glucagon increases the blood glucose levels and insulin decreases the blood glucose level. So the mechanisms are different. The physiological effects counterbalance each other and there is stabilization of blood glucose. Thus, the two drugs act through different mechanisms but the physiological function remains the same, that is regulation of blood glucose levels. The third example, CNS stimulants stimulate the nervous system and increase the activity of central nervous system. Thereby, they restore the mood, behavior, cognition. For example, amphetamine, codeine and caffeine. On the other hand, CNS depressants such as diazepam, alprazolam, lorazepam slows down the brain activity and used in the treatment of insomnia, muscle relaxation and other uses. So on one hand, there are CNS stimulants that increase the activity of the central nervous system and CNS depressants that slow down the brain activity. So the effects are neutralized, the mechanisms are different, but the physiological function remains the same, that is the effect on the central nervous system. Next is pharmacokinetic antagonism. Pharmacokinetic antagonism is the result of one drug suppressing the effect of a second drug by reducing its absorption or altering its distribution or increasing the rate of metabolism and elimination. This results in decreased concentration of the active drug at its site of action. For example, phenobarbital is an inducer of metabolic enzymes that is cytochrome P450 and increases the metabolism of many drugs. For example, the metabolism of warfarin is increased. This decreases the concentration of warfarin and decreasing its anticoagulant effect. Thus, phenobarbital increases the metabolism of warfarin, decreasing the concentration of warfarin and thereby decreasing the anticoagulant effect and increasing the risk of bleeding. The second example is that of urinary alkalizers in the management of poisoning. Urinary alkalizers such as sodium bicarbonate, sodium dihydrogen citrate increases the ionization of acidic drugs. This prevents tubular reabsorption of these drugs and increases the renal excretion of acidic drugs. Next example, the effect of hydrochlorothiazide and triamterene, a potassium-sparing diuretic, on urinary potassium excretion. Diuretics such as hydrochlorothiazide increases the excretion of sodium, potassium and chloride ions and causes hypokalemia because of increased urinary excretion of potassium ions. Triamterene is a potassium-sparing diuretic and antagonizes the effect of hydrochlorothiazide and helps to maintain serum potassium levels. So the effect of the combination is an example of pharmacokinetic antagonism where triamterene antagonizes the effect of hydrochlorothiazide and the effect is on urinary potassium excretion. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.